So I have my 25 and 5/8 inch needle that I used to draw up my solution. I should have used a larger needle earlier. And I'm going to don gloves. And you want to provide privacy at the bedside, and you're going to use 2 patient identifiers. So for this lovely arm, I'm going to ask him his name and birthday, and he says it's name and birthday. And then I'm going to draw up the medication after I compare it 3 times to the MAR and I've scanned it. So you're going to have your alcohol swabs nice and easily. You can be an alcohol waster, swab waster. I'm not touching the tip of either the syringe or the needle because those are sterile. And it's just door locked on. So when you do this, you're going to draw up 0.1 mLs of air. I'm going to slide my trash out of the way so you can see. Let that dry after I swabbed it. I'm going to inject the air straight in there. And as I pull it out, it should come out fairly easy. It necessarily didn't. I have a bubble in there. You probably can't see, but there's a bubble. So I'm not mixing it, so I can push it back in and draw it back out. And when you draw it kind of fast, it works better. So if you had a bubble left at the end, you could recap it, or you could roll it to get the bubble out. And you're gonna I'm just gonna lay my needle in there so I don't stab myself. I'm gonna tell the patient I'm gonna use the inner aspect of their forearm, and I'm gonna clean back and forth for 30 seconds and let it dry. I clean back and forth because that's what I've been teaching for 2nd years, but your book says to clean in a circular motion. I'm cleaning. You're going to let it dry. Our mannequins, and also it says to hold your alcohol swab between your 3rd and 4th non-dominant finger. You're going to remove your cap. You want the bevel up, which is hard to see, but that video does an awesome job. You're going to go at a 5 to 15 degree angle. You're going to feel it, and then when you push it in, it's going to make a blub. He made a small blub. And you're going to slowly remove your needle. And when you close needles, you're going to use the bedside table, not your finger. This is a safety lock device to close it so you don't stab yourself. You're going to feel a little bit of resistance as you insert it 1/8 inch into your skin, and a small blub will appear as a skin bite. You don't need to aspirate the syringe. We'll talk about that with intramuscular devices. And after you do that, you discard your needle into a sharps device. And if you had any glass, you'd want to discard that into the sharps device. So my sharps container's here. And then I will throw all my beautiful trash away. And that is how to do an intradermal injection. You could also, if you wanted to make sure you knew where you give it, a lot of times in hospital settings, they'll draw a circle to measure the blood as time changes. TB tests are read in 48 to 72 hours.